What is PR, and HER2 status on a breast cancer pathology report? Imagine your body as a complex communication network where signals tell cells how to grow and behave. When it comes to breast cancer, understanding these signals is crucial, and that's where PR, and HER2 statuses come into play. These are biological markers found on or inside the tumor cells, and they help doctors understand the nature of the cancer, guide treatment options, and predict how the disease might progress. First, let's talk about which stands for estrogen receptor. These are proteins on the surface of breast cancer cells that can bind to the hormone estrogen. If a tumor is positive, it means the cancer cells have receptors for estrogen, and they tend to grow in response to this hormone. About 80% of breast cancers are positive, making this a common type. To find out, pathologists use a test called immunohistochemistry, which stains the tissue to reveal the presence of estrogen receptors. Knowing that a tumor is positive is important because it means hormone therapies, like tamoxifen or aromatase inhibitors, can be effective. These treatments work by blocking estrogen or lowering its levels, which can slow or stop the cancer's growth and reduce the chance of recurrence. Next is PR, which stands for progesterone receptor. Similar to PR status is determined by testing the tumor tissue with immunohistochemistry. If the cancer cells have progesterone receptors, they are PR-positive. Tumors can be positive and PR-positive, or one can be positive while the other is negative. PR positivity also indicates that the cancer may respond to hormone therapy. Sometimes, a tumor might be positive but PR-negative, which can influence the choice of treatment and give clues about how aggressive the cancer might be. Overall, PR status helps refine the understanding of the tumor's biology and guides therapy decisions. Now let's explore HER2, which stands for human epidermal growth factor receptor 2. This is a protein that promotes cell growth and division. In some breast cancers, the HER2 gene is amplified, leading to an overproduction of the HER2 protein. These are called HER2-positive cancers. They tend to grow more quickly and can be more aggressive, but they also respond well to targeted therapies that specifically block HER2, such as trastuzumab. To determine HER2 status, pathologists use two main tests: immunohistochemistry, which measures the amount of HER2 protein on the cell surface, and fluorescence in situ hybridization, which detects if the HER2 gene is amplified. A score of 0 or 1+ on immunohistochemistry is negative, 3+ is positive, and 2+ is borderline, requiring further testing with FISH. If the tumor is HER2 positive, targeted treatments can be very effective and improve outcomes. All these markers, PR, and HER2, are part of the tumor's molecular profile. They help doctors understand whether the cancer is hormone receptor positive, HER2 positive, or triple negative, which means negative for all three. This information is essential because it influences the treatment plan. For example, hormone receptor positive cancers often respond well to hormone therapies, while HER2 positive cancers benefit from targeted HER2 treatments. Triple negative breast cancers, which lack these receptors, usually requiring different chemotherapy approaches. In summary, PR, and HER2 statuses on a breast cancer pathology report tell us whether the tumor cells have receptors for estrogen, progesterone, and the HER2 protein. These markers are vital for understanding the biology of the cancer, choosing the most effective treatments, and predicting how the disease might behave. Always remember, each person's cancer is unique, so it's important to discuss these results with your healthcare team to develop a personalized treatment plan. For any specific questions or concerns, consulting with a medical professional is the best step forward.